So even before I was a resident, as a student, I was keen to separate the most important things that you need to know from the least important things that you need to know to be a good clinician. And so as a student, I struggled to filter that information the best way I could. Again, not really being able to see the forest for the trees, but doing what I could. As a resident, I think one of my main goals was to help students do that. So I think it's hard, without having been a clinician, to know what a clinician needs to know, or to have the skills that a clinician has, or to know what skills you need to develop to be a clinician. And so you're trusting the people that are educating you.
Yeah.
So when I say the forest versus the trees, I think the idea is perspective, right? So you just don't have the perspective necessary a lot of times to judge what's important to know versus what isn't. And for that you rely on the people who are guiding you, which is to say your teachers.
I think there were two things that I was really trying to achieve, I think, during the residency program. The first was a really good working relationship with students where the content can be delivered seamlessly or in a way where people are actually engaged and paying attention and actually deriving something from the session. And then the second objective was more of a personal one, as I had mentioned before, which was to sort of develop a stronger sense of confidence and competency in the areas that we had studied previously. So for my first goal, the way to achieve that, I think, the awesome thing about the residents, I think, is for the most part there is an affinity towards teaching and trying to make sure that you're engaging people and you're engaging students. So I think to try and make it as relaxed as possible and to make it so that students actually feel interested in the material and comfortable. So I think to try and get them interested, I mean that's always the challenge, right? But making sure that your presentations are innovative and creative, and you're looking at different learning styles, and you're making sure that there's a visual aspect, there's an auditory aspect, there's a tactile aspect. Making sure that people are getting up and moving around, I think, is important as well. Helps you reset and helps you kind of keep engaged. Tried to make sure that I was available outside of the classroom so that if anybody needed a little bit more one-on-one attention, that was always possible. And I think generally speaking, the relationships with students for the most part was really positive, and that was great for me because it kind of it just reignites your willingness and your desire and your motivation to do what you're doing. Second goal of just developing competency, I think, just came with time. And the fact that you end up having to prepare for everything that you do, every presentation you deliver, every lecture that you end up having to be a part of, you have to prepare on your own anyway beforehand. So you end up reviewing the content quite a bit, going over it quite a bit, which is great because it sticks a lot better. And so that a year down the line, you TA one course maybe in your first year and then you TA it again the second year, it's easier. You remember the content, you understand it, you're better able to answer questions. And so as a practitioner then, you take that knowledge and you take that competency and you apply it to clinical practice, which is pretty awesome.
I'm not sure as a resident that I had my thoughts that well clarified. I think I was probably more selfish at the time. I was doing it more so for my own gain and purpose than I was for my students. And I think that, to be honest, is reflected in how student feedback of me has shifted over the years. I think as a resident I tended to get feedback that reflected that I was trying maybe too hard to have a certain presence or to be knowledgeable. I was probably overcompensating for insecurity, right? I was brand new and it's tough as a first or a second year resident to then step into the role of teacher and supervisor. It's understandable that students would feel like, what does this person have to teach me? But, frankly, every additional year of experience and knowledge is valuable, and there's something that everybody has to teach other people. I think I was less aware of that than I should have been and probably overcompensated for that. So I think that most of my learning and most of my impact on my students has been since the residency, but the residency helped me get there. So for me, I think the key points that I became aware of at the time and still are important to me is the importance of self-directed learning and the fact that instructors, mentors, supervisors aren't there to spoon feed knowledge, but are there to facilitate learning. And I tend to have a little bit of low tolerance for students who don't engage in their learning and who are passive or who don't take an active role in facilitating their own learning. And I certainly was aware of that as a resident, and it was something that frustrated me at the time, and it's taken a number of years to learn how to handle those situations, and I'm still learning how to do that effectively. But I would say that in an academic institution like this, where you're working with students, that's the most important piece, because we can't possibly teach students everything they need to know before they leave here. It's impossible. So all we can hope to do is teach foundational principles, foundational concepts, and the skills of lifelong learning, so that students can then take that out and apply that to novel situations and address their own learning objectives. Definitely, and particularly in a program like this where there is a lot of hands-on and a lot of practical opportunities, you know, it really is up to the student to come prepared and to come having developed questions, you know, and having the ability to reflect what they need to know, as opposed to being a blank slate waiting to be written on. And I became aware of that very quickly as a resident, and as I said, I've had to work, and I continue to work on strategies of engaging the learners rather than doing what learners find easiest, which is just sitting back passively and you know, exactly. And that's the easiest way to teach too, right? It's a lot easier to prepare a lecture and stand up and deliver the lecture and not have anybody ask questions and not pose questions to the group. That's a really easy thing to do, and it's easy for students to receive. But we know from scholarship around learning that it's actually not an effective way to learn. So I'm constantly exploring different ways of engaging my students, not only in a practical way, but also in a motivational way, you know, that I want my students to want to engage in their learning and trying to discover ways of facilitating that.
So when I went into the program, I had always been, so I like the, you know, the education part of it, TAing and that sort of thing. And I think my style was more, I wanted the students to figure out things on their own, which is problem-based learning. So I was the sort of teacher and TA where I gave them a little bit more flexibility to try things out or figure things out. I think that was my approach also as a supervisor. And I think that reflects on how I work with my patients too, because I'm not like, okay, this is the one way and this is the only way you can do it. You know, it's more of a discussion and what do you think and so on. So I think that's probably my main style that came out of TAing and what I figured out about myself.
Well, I guess my goal changes depending on who you're talking about. So if we're talking about my personal goals, I would think of things like I mentioned, improving my skills, getting better, getting more comfortable, seeing patients, that kind of thing. If we're talking more broadly, I would say I wanted to develop better systems for promoting evidence-based medicine, and I wanted to provide other NDs and students with more evidence-based naturopathic medicine. So I think that's what the research residency in particular gave me time to do, and gave me an opportunity to write review articles and do research and publish evidence and sort of help promote that approach to things.
So with teaching students, I guess my main goal was to give people the tools and the skills to be able to critique knowledge. So I think that we live in an environment where we have so much information readily accessible to us, but we don't necessarily know what information is valuable. And I think that when we go through this program, a lot of times when we're starting out in some of the more lecture-based classrooms, there's so much content, right?
Definitely.
And I think that people get overwhelmed with the content and they don't start thinking about, well, do I actually have the skills to be able to figure out what I need in order to treat a patient? And that's where I think the discrepancy comes when you get into clinic and you're the one in charge of applying the knowledge to your treatment plans. So I really wanted to give people those tools and those resources, because I think that you can always access content afterwards, but being able to actually have those skills to be able to figure out, well, what's the best evidence and how do I know that this is the best evidence, and actually formulating what questions am I trying to answer. So those were the goals I had when I was teaching, to try to really inspire a sense of curiosity, but then also to help them develop those tools to find the information they needed. I also really wanted to help people discover their own style of practice. So I think that a lot of times we're so inspired by really experienced NDs, and we want to model their style, but I think we really need to figure out what makes sense for us. And kind of, growing in that setting and figuring out how we want our own practice to look.
And how did you approach helping people, helping like the students that you were supervising or the students that you were teaching? How did you help them to give more thought towards that, like developing their own as their own?
And I think this is an aspect of the college that a lot of students get frustrated with. It's really challenging them. So when they ask a question, not just giving them the answer. And I think when I first started out and you're less experienced, that's kind of your gut instinct, is to just give them the answer because you know the answer. But you really want to give them the tools to find it for themselves. So challenge them to really deconstruct, well, what are they asking, and what resources do they have available to answer that question. And I think the more you put students on the spot, the more they know to do that and to look into it themselves, and then to come with less content-driven questions and more critical appraisal questions. Like, well, where can I find out how to figure out if this is a good test for diagnosis? And the nice thing is, the more that that's become inherent in the courses we're teaching, the more you see people asking more critical questions.
No, there wasn't. Because a lot of that kind of just presented itself along the way. So things that did come up, because I really didn't have a game plan, I knew I knew I would be fine clinically because that's what I love. I knew I would be fine at teaching because I knew that's what I love. But why I did it, or the things that maybe came up, were really, really helping to teach in a way where I also was a learner. Where I was also learning. So it wasn't just one-sided, and it wasn't just me to student, for example, or me to body of students. Where I was also receptive to learning from not only my mentors, but from my peers, my colleagues, and from the students themselves. So that was something that I thought of. And then when I was teaching more of me to students, then thinking of how can this learning be less of memorization, which is the case with so many of us, and that's not a problem, I think, until it becomes a problem. So more of facilitating understanding versus get me through this time period and get me through to the examination, really broadening it out. Even with the first years, I'll put myself into that position where, for example, I was a TA for physiology. And physiology first year is very, very interesting crew, because what do I need to know to pass this exam? So taking you out of the concept of exam mode and taking you into, now if you're a doctor, if you're a naturopathic doctor, if you're working with a patient, why would that make sense? Why would that be important? And can we broaden our minds a little bit to kind of think of that? So I feel, to answer the question as quickly as I can, is just stretching us out of the concept that we are in. So not just a student, but what are we doing this for? Why are we doing what we do? And how can we now approach it from that angle versus, I need to pass this exam. But when you realize that you're not just in it passionately for the examinations, you're in it passionately because you want to help people in whatever aspect of their lives or whatever their story is, you realize that there's so much more to capture in the moment. And so that was hopefully what I strove to impart.
I tried to think about, as a resident, what that was versus what that is now. But I think when I was a resident, what I tried to do was try to remember what it was like as a student, and to try to remember, how I learned, which TAs were effective, most effective, or which lectures are most effective, how I learned the best, like the lessons that I learned, the clinical pearls that I learned, and I tried to remember that perspective when I was then teaching as a TA, as a resident, let's say, or I'm not sure how much I lectured as a resident, not a huge amount, if anything, but so I think that's what's nice about being a resident, is that you can carry that unique perspective of being a student only a year ago or maybe 2 years ago, and so it's this really interesting place where you're bridging the gap between clinicians who have been out for a long time, or even elders, but yet also being able to bring the perspective of a recent student. So maybe your teaching methods are a little bit more better suited to the students because you were just there. And you remember what it was like. You remember what worked well and so on. And I think also students can relate to you better in that sense. So they know that you understand a little bit better, and you're not sort of out on a different reality. So I think that's kind of something that I tried to remember to bring to the students. And yeah, I mean the other perspective I think as a resident was being in the residency program. I was able to see sort of again the pros and cons of the residency program, and so I remember at that time myself and Dr. Kennedy and Dr. Uraz, who were the residents at the time, we tried to set up some stuff in place for the next set of residents, so that their experience was going to be as good as ours and even better, and so so we were able to kind of put some ideas together and talk to management here, and to try to put in some improvements for the residency program, which they took wholeheartedly and listened with an open ear, and I think over the years, like I said, the residency program has just gotten better and better and better, and that's from input from each class of residents.
Really wanted to solidify my experience in research. I wanted to present quite a bit in terms of research, so I set myself up with a goal to present twice a year. And so, went to quite a few conferences in order to do that, which was excellent in terms of networking, and just excellent in terms of building your confidence as an ND, and what an ND can do to impact evidence at large, right? So that was wonderful. I also wanted to write and cultivate that research writing capacity. So I set a goal for myself to write in all of the larger publications that we know in naturopathic medicine. So that was the Vital Link, the NDNR, the IHP, and then a few others. So that was important to me. And then I wanted to see a project through. So from a research perspective, that was the hypertension project that I did. And I wanted to see that it had practical impact. So starting to finish, and then creating a bit of a practical checklist for interns and supervisors to utilize after it was done. So those were my goals from a research perspective. From the rest of it, the rest of the residency, I really wanted to develop my teaching style, and I wanted to have more impact with students. And so knowing that was a goal, I really ensured that I put a lot of energy and a lot of time into developing what I wanted to get out of my teaching, right? So in each of the courses, I really looked to figure out what my impact would be there, and it was quite individualized for each course. But especially in the clinical supervising year, I developed a bit of a pseudo curriculum for my interns, and really ensured that they had an arc to their development in their last year. So so all of that kind of put together were large goals of personal and professional development, really pushing myself on various levels, personally and professionally, and developing skills that I had planted seeds for through my CCNM career and previously, but I wanted to see flourish through the residency, you know, the residency has a really nice way of giving you back what you put in.
Mm-hmm.
And so if you kind of go into it being thoughtful and being intentional in the opportunities that you seek within the residencies and the you know, impact that you have, you can really get quite a bit back from it. So yeah. Mm-hmm.
So I've got two big ones that I kind of want to talk about. So one,
Sure, yeah.
One's the cancer research.
Okay.
It's kind of trendy right now to be doing cancer research. That's not why I'm doing it.
Mm-hmm.
I'm doing it because it is my passion. And I have some legitimate questions and concerns about using turmeric in cancer. Because there's these new formulas that are coming out that are pretty close to pharmaceuticals.
Okay.
They're giving turmeric in doses or with absorption that is not possible in nature. So a lot of people eat this stuff, but these new formulas increase the amount of curcumin, one of the constituents in your blood, tenfold or more, and it's just not possible to get that through food. That's why they want to do it. They're doing it intentionally because that's the ingredient that's supposed to kill cancer. That's the ingredient that shuts down inflammation in your body. But we don't know if that is going to mess with enzymes and metabolism of other drugs. So is it going to interfere with chemotherapy? Is it safe to give with chemotherapy? Does it cause other effects in the body that we've never been able to study before? So I want to make sure it is safe, and I want to see if it works. And if it does work, fantastic. I'm all for it.
Yeah.
But I want to make sure it's safe for my patients.
Yeah.
So that's one of the reasons I really want to do that.
Yeah.
So that's one of the impacts, is answering some of those questions.
Definitely.
And the other side of things is more of an art of naturopathic medicine. So as much as I'm the research guy, there's
The research guy.
the research guy. There's a therapeutic order that we follow, and it's based on the least impact. So we're looking at prevention, we're looking at diet and lifestyle, and the basis of good health to help prevent and also to treat. So why jump to a high impact, expensive, risky procedure like a surgery or some pharmaceuticals when it can be treated more simply, more safely? We just don't have necessarily the evidence to back it up. We've got clinical experience. The entire philosophy of naturopathic medicine is doing it gently, doing it healthily. And I want to bring that back in, because there's a lot of talk right now about orthomolecular medicine, doing high-dose vitamins, doing proprietary forms of turmeric, as another fantastic example. When those are newer forms, and we don't necessarily know the full impact of it. So I want to bring us back to our roots. So what I'm teaching my students in clinic, I've got a whole series planned for September.
Awesome. Oh my gosh, I wish I was in clinic so I can hear this.
I'm sure we'll make it available at some point.
Oh, awesome.
Bring us back to our basics. So we know that diet and lifestyle is key, and a lot of the interns are really good at mentioning the diet and lifestyle. I want to bring back the importance and why we're doing that, and just sort of teach on that lower level and see if we can firm the basis of health before going to the higher impact therapies.
I think, yeah, for me, I spent 4 years, like, there were really hard times, but most of it I just loved the whole way through. Like, I don't know, I've had such a sense of community and support, but also just excitement and learning everything. That I wanted to make sure that I could kind of pass that on to other students. Just give them an opportunity, either whether it was something I could teach them or just as a mentor for students to be able to come to, so that they could really see how great CCNM can be. Sometimes it's easy when you get stressed and things go wrong to have a really negative thoughts about the school or the program or whatever, and I really didn't feel that way, and it's something I wanted to be able to just help the students with. So if they could maybe see, like, I finished the program and got through it, so you can too. And I wanted to be someone that the students that I teach can come talk to if ever they have problems, because I feel like I'm pretty real about it. I mean, I know that I'm saying how exciting it is, but there were really hard moments too, and I'm not going to pretend there weren't. And I also just love, I love that feeling when you finally understand a concept. So whether it was understanding the cervical manips or really how 5-element theory works in Asian medicine or anything with like pathophysiology, I love it so much. And that moment where like when I was with some of my roommates when we'd be studying and I would teach them something and then they'd be like, oh, now I get it. I wanted to be able to help more people do that. Because just it's something that I've always loved doing, and I was a teacher for dance and a TA all through university.
Awesome. Yeah.
And my parents are also professors, so it's probably part of who I am. I just really enjoy it. And that's something I thought when I first applied for the residency program, I thought to myself, okay, I want to be in clinic and I want to be a supervisor, but I definitely don't really know if I want to teach. And it's actually been my favorite part. Yeah, it's so weird how that happens. And MNIPs are like my favorite class, and that was my worst thing. So it
like
really helps.
Yeah.
That was something that I felt this need to, I really loved watching students understand something, so it became fun to find ways to show them how.
Yeah.
And something for me was that I really struggle with, perhaps it's confidence, but also just being assertive. And I knew that this would be difficult for me because there's times where you need to be able to have both. You need both of those as an ND, but also as a resident. And this program has really helped me. Even this year, how I've noticed a change within myself and in the other residents that I'm friends with. And so I'm really grateful for that.
I'd say that my focus has changed depending on the course or the year that I was instructing, but this past year, because I was working with the interns, the 4th year interns in the clinic, the teaching clinic, so much that I really tried to encourage them to try different things and broaden and challenge themselves and not be afraid of making mistakes or not and holding back. I wanted them to really expand their horizons here and really leave their ego at the door. So that was my thing. Don't be afraid to make mistakes or say when you don't know. We're only humans. We're not magically, after 3 years of medical training, we're not magically all-knowing and all-powerful beings, right? So it was mostly just, okay, work within your means. Don't be someone you're not, and be true to yourself and push your boundaries. Be yourself. Don't be afraid to go outside your comfort zone. Those are my two
And then because you're a 2nd year resident, so you're completing your residency this year.
Yes.
So what would you say, because you also mentioned that it kind of shifted because you're working with a different group of students, different, because they're interns now. What would you say your focus was during your first year as a resident?
My first year of residency was more course-based. I supervised fewer interns, and so, but I think my message stays true. I think, challenge yourself. Don't be afraid to try new things. Go discover things, basically. Go discover, explore, ask questions, really see what there is, and don't be afraid to challenge what has been sort of laid out before you, right? And so again, continue to grow and see what you can find.
Yeah.